Hello.
Everyone, my name is Noureen Ahmed, and today I'll be discussing my master's thesis topic, Provider Experiences Implementing Group Care, a Qualitative Study. To get us started, we'll be defining Group Well Childcare. Group Well Childcare, or Group Care, is an innovation in primary care delivery that may help meet the quadruple aim of healthcare. This focuses on enhancing patient experience, improving population health, reducing costs, and improving the work life of healthcare providers. To better understand the group care model, it essentially has multiple families with the same age child coming together to be individually assessed by providers and then transitioning into a larger group style discussion. With the groups focused on ages, we'll have newborns meeting together and they'll discuss topics such as breastfeeding. And then as they get older to 1 to 2 year olds, they will discuss topics such as nutrition or dental hygiene. The group care model really focuses on the patient's needs and engages discussions among the patients as well as with the provider. Some background on Group Well Childcare. It was first coined by Dr. Martin Stein, who is best known for his publication in Group Well Baby Care from the late 1970s. The group care model in pediatric primary care has shown to improve adherence to appointments and vaccinations, as well as outcomes in mental and physical health for children and patients, patients, as well as for parents and guardians. And in a qualitative evaluation of individual care versus group well child care, they found that those who participated in group care were more satisfied with their social wellness visits. So when assessing the literature of group well childcare, we found that there were fewer than 100 total articles. Most of what was known about group care derived from quantitative-based studies. So the ways that provider experiences group care was yet to be empirically assessed in a national sample using open-ended interviews, which brings us to our study. So the problem that we are assessing in our study is what are providers' experiences and perceptions implementing group care model for well child care visits. The objective of this study is to characterize the experiences and perceptions of healthcare providers participating in group care in the US and their designs and implementation of group care models using a qualitative semi-structured interview. So in order to recruit patients, we leaned on a list provided by the co-leaders of the group care network in New Haven, Connecticut. The providers were emailed asking if they would be interested in participating in an interview to better understand the practices of group care and their perspective on the experience. We believe that interviewing 20 participants would allow for us to reach thematic saturation. So when it came to data collection analysis, we used a semi-structured interview, as mentioned, to conduct and record the experiences of these healthcare providers. We used a guided questions script that highlighted participants' history, experiences, successes, challenges, and other strategies for a group care model. These questions were created by pediatricians who were involved in group care, as well as by a social worker involved in group care. These interviews, were conducted via phone calls and were audio recorded and transcribed by hand and by a website called Temi. And then these transcripts were then uploaded into Deduce and coded there for similar themes as well as for significant quotes. Some ethical considerations. This was exempted by the Yale IRB. We received verbal consent after reading a consent script before starting the interview. After reading the script, the participants were given the option to pause, ask questions, or stop at their discretion. All data was then collected and stored at Yale Box, an encrypted and secure web-based folder. So our findings for this study were we used 20 providers who were interviewed. Participants covered 10 different states. The providers practiced group care in 11 different institutions, and the interviews lasted an average of 32 minutes. If you look to the right, you'll see all the states where we had our providers being interviewed from. So the first theme we identified was integrated provider and patient education. The group care model serves as a foundation for teaching and learning for both providers and patients. Throughout our themes, you'll notice there are quotes that help really highlight the themes that we identified. This group care format really allows providers to build an environment which thrives off the concept of modeling and engagement. And instead of the usual provider lecturing, it really allows for the peers of the patients and the families to talk to one another and highlight what they know versus what they don't know, and have the provider kind of step in when needed. The second theme we identify is mindfulness. This allotted time of 2 hours or what it may be allows participants, the providers specifically, to really not worry about their busy schedules, their one-on-one back-to-back visits, but to really take the time that is allotted for them to engage and build relationships with their patients and parents, and allows them to cultivate trust and build a better understanding of what their patients' needs are and how they are growing over time. The third theme that we identified is community. The group care model provides a structure that creates community among providers and their teams, as well as among families and their child patients in groups. The interviewee stressed that a sense of community is built when group participants are comfortable, trusting, and respectful of each other. And some of these groups actually take this level of community past the in-person appointments, and they go as far as creating private Facebook groups and WhatsApp group chats, and that have grown over the last few years of their group care model being at their institution. Here you'll find a quote really highlighting how community is built at this specific provider's institution. The last theme that we identify is organizational burden. Even though there are so many positives from the group care model, the participants highlight the difficulties of being a provider throughout the group care model. And sometimes the work that it entails can lead to burnout associated with its delivery. So the group care model requires extensive planning and coordination, and the lack of administrative and nursing support really challenges several of these interviewees in being able to continue working in the group care model. Below, you'll find a provider who has really struggled with having attendings and faculty participate in the group care model because of the work that is involved outside of just looking at seeing the patients. To summarize our findings, we found that the providers give positive reviews, not only on their own experiences, but from the experiences of patients, residents, and healthcare colleagues. The model really incorporates and fosters community, and they've identified group care as a useful tool to engage parents and their child and the children, as well as giving patients and the parents an opportunity to build community and empowering the parents as time goes on. Some limitations we faced was a lack of diversity among the providers, specifically in terms of region where they practice. While we believe that we reached thematic saturation upon completing these 20 interviews, we don't necessarily cover the full 50 states. So there is a chance that we didn't reach thematic saturation and a study could be needed the study could continue to identify other experiences that providers have. We also identify the potential of self-selection bias as a potential limitation, given that these providers were emailed and recruited based on their wanting to be there. And they could potentially be the ones who feel overly positive about group care. Our recommendations of group care are: it has the capacity to grow in number and practice and really benefit communities. Group care can address challenges that providers face when practicing traditional forms of care, and more time with patients and stronger administrative teams, as well as institutional support for group care, can help lower provider stress and burnout over time. We overall recommend researching group-well childcare and the association with improved mental and physical health and well-being for pediatric patients. In conclusion, we developed 4 themes that cover and characterize these providers' group care experience: 1, integrated peer and provider education; 2, mindfulness; 3, community; and 4, organizational burden. Overall, these themes and the 20 interviewees were candid and expressed the value of being included in the circle with their patients and fellow providers, all of which cultivates the meaningful experiences of the group care model allows for. And here you will find the appendix of the recruitment email, the interview guide, the consent script, and the references. Thank you very much.